the patient walks in with failing teeth, and when they leave with a fixed set of teeth which they can function and smile properly with.
Amazing, look, I got teeth.
Teeth in a day applies to a treatment wherein a patient comes in, they have a lot of failing teeth that need to be replaced. So what we do, instead of replacing each tooth with a dental implant, we place a minimum of 4 and up to 6 implants, and then we have a new set of teeth that are placed over. This is all done within a day. So the patient walks in with failing teeth, and when they leave with a fixed set of teeth which they can function and smile properly with. This is obviously just a temporary, and they do need to come back 3 months later once it's all healed to have something that's custom made. But essentially, when they walk out on the same day, they have a new lease of life because they have a new set of fixed teeth that look good and function well. So who is it for? There are patients who had not seen the dentist for a while and have a lot of their teeth failing, either due to decay or gum disease, or sometimes, in very sad cases, even trauma. Or if you have a patient who's had a partial denture and you have a few more teeth that are left, around 4 teeth or less that are actually healthy in per jaw, it might be better considering having a full arch implant bridge. So once the consultation is done, the planning has been done. On the day of the appointment, the patient turns up, the whole day is set out for them. We have a whole clinical setup. We have a team ready to take care of the patient on the day. We have normally a couple of nurses. We have a lab technician on site. Make sure that patient's medical history is fine. We give patients pre-op antibiotics, steroids, painkillers, just to make sure it's more comfortable for them. In very rare cases, we do have patients who are very nervous, and although the treatment itself isn't painful, it's a long day of treatment, and for a nervous patient that might be quite daunting. So we have the option of having conscious sedation, where we have a dental sedationist come in. We use drugs like midazolam that are quite safe in the dental setting. Once we've given you the pre-op drugs, we numb them out and we take out the teeth. All the designing of where the implants go, what the teeth look like, is done prior to the day. So we have a fixed set of teeth, which is either on a denture, or we use 3D printers to nowadays print a temporary set of teeth that is ready on the day. So say, for example, you come in at 9 o'clock, we start your treatment by 9:30. In a couple of hours, we have all the teeth taken out. We have a minimum of 4 implants placed, or up to 6 implants. And then the second half of the day is near us taking impressions of your mouth, and then the patient just relaxing in the surgery while our dental technician starts making a custom bridge made for that patient. So what we actually do is they have the molds of where the implants were placed. They put metal bars to connect these implants and have a wraparound of teeth around them so that that bridge is solid and not going to break during the 3 months healing period. While the denture is being made, the patient's resting in the chair, either watching the television or listening to some music and just zoned out, holding some ice packs. We give them some cold drinks, juices to have, just so that they feel nourished as well, and make sure they're not in pain. Once the bridge is ready, we then seat this bridge in the patient's mouth. We tighten it down with some screws, which the patient can't feel, and we check, one, that the patient's bite is good, and secondly, the patient's happy with the smile. When the patient then leaves with their aftercare pack, they actually feel less pain having the bridge than if they didn't have it, because when they have a bridge and they're biting, that bridge doesn't move and there's no pressure on the gums. So the gums can heal independently and without any pressure on them. Because say, for example, some clinics, they would give you a temporary denture in the meanwhile, which then puts pressure on the gum that has just been surgically treated. That makes it even worse for the patient. Most patients, I've noted, come back reporting minimal to no pain. There's some sort of discomfort because the patient's obviously had quite a lot of treatment, but it's nothing that cannot be managed with painkillers and antibiotics. Now, the teeth in the day term is mainly referring to the day where the patient walks out with a temporary set of teeth. Now, just bear in mind, this is just a temporary set of teeth, but the beauty about it, it gives the patient kind of like a test drive. They get to function with it, so they know that they can eat comfortably with it. And then secondly, they can also give us feedback on whether they like the teeth. Some patients come back saying, you know what, I'd like my teeth to go a little whiter. I would like people to know that I've had my teeth done. Some patients say they want to have it more natural, bigger, smaller. The most common feedback we also get is patients find a bit of lisping. What's happening while the implants are healing? The gum starts shrinking back as well, creating a slight space between the bridge and the gum. 3 months down the line, we then take impressions or molds of their gums. So then we have a custom-made final bridge that fits snug against the gum, and reducing any of these residual spaces that are left behind. The final bridge is then made in different materials, which could be polyceramic, acrylic, zirconia. These bridges are much thinner than the final bridge. They look superb, they're smooth and comfortable to eat with. Once treatment's done and complete, all the patient needs to do is maintain immaculate hygiene, because the hygiene is the most important thing to make sure your implants last. So if you know anyone who's thinking, someone that needs an overall change for their teeth, teeth in a day may be an option. You also have other options, but the best thing is to get in touch and we can advise you on what's maybe the best thing for your situation. I'm Dr. Ashwin. Don't forget to like and subscribe for more dental tips and advice.